Hello, everyone. Today, we will begin learning about the pharynx and esophagus. First, let's look at the morphology and structure of the pharynx. The pharynx is the enlarged part at the upper end of the digestive tract. It serves as a common passage for both the digestive tract and the respiratory tract. The pharynx is funnel-shaped, wider above and narrower below, and is a muscular tube that is slightly flattened anteroposteriorly. It is about 12 centimeters in length. Its internal cavity is called the pharyngeal cavity. The pharynx is located anterior to the first to sixth cervical vertebrae. Its upper end begins at the base of the skull. Its lower end, at approximately the level of the inferior margin of the C6 vertebra, or the cricoid cartilage, is continuous with the esophagus. The anterior wall of the pharynx is incomplete. From top to bottom, it has openings leading to the nasal cavity, oral cavity, and laryngeal cavity. The posterior wall is flat. It is connected by loose connective tissue to the prevertebral fascia on the anterior aspects of the upper six cervical vertebral bodies. This type of connection facilitates the movement of the pharyngeal wall muscles, but can also serve as a basis for the spread and extension of inflammation. The lateral walls of the pharynx are adjacent to the major blood vessels of the neck and the lateral lobes of the thyroid gland, among other structures. 2. Division of the pharynx. The pharynx, commonly known as the throat, based on its anterior relationships, and bounded by the plane of the free margin of the soft palate and the superior margin of the epiglottis. The pharynx can be divided into three parts: the nasopharynx, oropharynx, and laryngopharynx. Among these, the oropharynx and laryngopharynx serve as common passages for both the digestive and respiratory tracts. The nasopharynx is the upper part of the pharynx, located posterior to the nasal cavity, extending superiorly to the base of the skull, and inferiorly to the plane of the free margin of the soft palate, where it continues as the oropharynx. Anteriorly, it communicates with the nasal cavity through the choanae, posterior nasal apertures. On the lateral walls of the nasopharynx, approximately 1 centimeter posterior to the inferior nasal conchus, there is a pharyngeal opening of the auditory tube, eustachian tube, on each side. The pharyngeal cavity communicates through this opening via the auditory tube with the tympanic cavity of the middle ear. The pharyngeal opening of the auditory tube is usually closed. During swallowing or forceful opening of the mouth, air passes through the auditory tube into the tympanic cavity. To maintain air pressure balance on both sides of the tympanic membrane during infections of the pharynx, bacteria can spread through the auditory tube to the middle ear, causing otitis media. Because the auditory tube in children is shorter, wider, and somewhat horizontal in position, children suffer from acute otitis media far more often than adults. The arched elevation anterior, superior, and posterior to the pharyngeal opening of the auditory tube is called the torus tubarius. It is a landmark for locating the pharyngeal opening of the auditory tube. Posterior to the torus tubarius, the longitudinal deep recess between it and the posterior pharyngeal wall is called the pharyngeal recess, fossa of Rosenmuller. It is a common site for nasopharyngeal carcinoma. Lymphoid tissue within the mucosa near the pharyngeal opening of the auditory tube is called the tubal tonsil. In the posterior part of the superior wall of the nasopharynx, the mucosa contains abundant lymphoid tissue, known as the pharyngeal tonsil adenoids. It is well developed in young children, begins to atrophy at 6 to 7 years of age, and is usually completely regressed by about 10 years of age. In some children, the pharyngeal tonsil may become abnormally enlarged, causing narrowing of the nasopharyngeal cavity and affecting respiration. manifesting as mouth breathing during deep sleep. Oropharynx. Located between the plane of the free margin of the soft palate and the superior margin of the epiglottis. It communicates anteriorly with the oral cavity through the fauces, or pharyngeal isthmus. Superiorly, it continues with the nasopharynx. And inferiorly, it leads to the laryngopharynx. The anterior wall of the oropharynx is mainly formed by the posterior part of the tongue root. Here, there is a sagittally oriented mucosal fold, called the median glossoepiglottic fold, which connects the midline of the posterior tongue root to the epiglottis. The deep depressions on either side of the median glossoepiglottic fold are called the epiglottic valleculae, which are common sites for foreign body lodgement. On the lateral walls of the oropharynx are the palatine tonsils. The palatine tonsils are located in the tonsillar fossae on the lateral walls of the oropharynx. They are lymphoepithelial organs with defensive functions. The palatine tonsils are oval in shape. Their medial surfaces face the pharyngeal cavity and are covered by mucosa with many deep recesses called tonsillar crypts. Bacteria can easily multiply here, becoming a focus of infection. The lateral, anterior, and posterior surfaces of the palatine tonsils are surrounded by a fibrous capsule formed by connective tissue, known as the tonsillar capsule. Additionally, the superior part of the tonsillar fossa, not filled by the palatine tonsil, is called the supratonsillar fossa. Foreign bodies often lodge here. The pharyngeal tonsil in the nasopharynx, the tubal tonsils on both sides of the pharynx, the palatine tonsils, and the lingual tonsil at the root of the tongue together form the lymphoid ring of the pharynx, Waldeyer's tonsillar ring, which has a defensive function for both the digestive and respiratory tracts. The laryngopharynx is the lowest part of the pharynx. It is somewhat narrow superiorly. It begins at the plane of the superior margin of the epiglottis, and inferiorly, it extends to the plane of the inferior margin of the C6 vertebral body, where it continues with the esophagus. The upper part of the anterior wall of the laryngopharynx contains the laryngeal inlet, which leads into the laryngeal cavity. On each side of the laryngeal inlet, there is a deep recess called the piriform recess or piriform sinus. This is a common site for foreign body lodgement. Position and parts of the esophagus. The esophagus is a muscular tubular organ that is flattened anteroposteriorly. It is the narrowest part of the digestive tract. It is about 25 centimeters long. The upper end of the esophagus, at the level of the inferior border of the C6 vertebral body, is continuous with the pharynx. Its lower end, at approximately the level of the T11 vertebral body, connects to the cardia of the stomach. The esophagus can be divided into cervical, thoracic, and abdominal parts. The cervical part is about 5 centimeters long, extending from the beginning of the esophagus to the level of the jugular notch of the sternum. This segment is attached anteriorly by loose connective tissue to the posterior wall of the trachea. The thoracic part is the longest, about 18 to 20 centimeters, located between the level of the jugular notch of the sternum and the esophageal hiatus of the diaphragm. The abdominal part is the shortest, only 1 to 2 centimeters long, extending from the esophageal hiatus to the cardia. Its anterior aspect is adjacent to the left lobe of the liver. Constrictions of the esophagus throughout its course Besides following the cervical and thoracic curvatures of the vertebral column, resulting in corresponding antero-posterior curves, it also has slight curves in the lateral direction. However, morphologically, the most important feature of the esophagus is the presence of three physiological constrictions. The first constriction is at the beginning of the esophagus, at the level of the inferior border of the C6 vertebral body, about 15 centimeters from the incisor teeth. The second constriction is where the esophagus passes behind and is crossed by the left main bronchus, at the level between the T4 and T5 vertebral bodies, about 25 centimeters from the incisor teeth. The third constriction is where the esophagus passes through the esophageal hiatus of the diaphragm at the level of the T10 vertebral body, about 40 centimeters from the incisor teeth. These constrictions are common sites for foreign body lodgement and for the occurrence of esophageal cancer.